She's a Harvard Yale-trained integrative psychiatrist. She's going to discuss here today childhood developmental delays, stressors on the developing nervous system, research related to microwave EMF and other toxic exposures, and how this has changed her approach to clinical care. She's a very thoughtful practitioner. She has many years of experience. She's now focused on causes and improvement in children with autism spectrum disorder. We appreciate your time to be here. Thank you so much. Sorry, we're going to talk more generally about childhood developmental delays and environmental issues first. And then we'll look more specifically at EMFs and then what we can do given the state of science. I'm a clinician primarily, so I want to know what can I tell my patients to do now, even when the science isn't conclusive. So looking at childhood developmental issues, there's been a dramatic increase in autism and other developmental delays in the last 10, 15 years. So the current CDC statistics on autism are 1 out of 68. About 15 years ago, it was 1 out of 10,000. So there's been a huge difference. And now about 1 out of 7 children has some developmental delay, almost 15% of children. So these are children who may not have autism, but they have some symptoms that are similar. They may have a speech delay, they may have motor delays, they may have sensory processing issues, auditory delays. I assume all of you at some point have probably seen a child like this because it's so common, especially if you interact with children in the school setting or you have grandchildren or your own children. So this is a setting. And I'm going to focus initially on the research looking at autism because that's where we have the most research looking at environmental contributors. But we can extrapolate some of this when we think about all of these childhood disorders. So first, what's the evidence that we even need to look at the environment? That's the first question. So most doctors aren't even asking this question. They're thinking that these issues are hardwired in the brain, they're genetic, and there's not much we can do other than maybe medication or therapies like OT or PT. So what is the evidence that we have to think about the environment? And there are 3 lines of evidence. The first is looking at rates of autism, the epidemiology. The second is genetic studies, and the third is association studies. So this is the rate of autism just in California. You can see there's been a huge exponential increase in autism since 1987. And during the same time, when we look at other illnesses such as CP or epilepsy, we don't see this increase. So what's behind it? And this was a question asked by a researcher at one of the UC schools, Dr. Hertz-Picodi. And she said, is this caused by things like better diagnosis or people moving to California because of better services? And she said, no, these things can't explain it. And she looked at other things like genetics. And she said, well, we can't implicate genetics because we don't have a genetic epidemic. Genes don't change that fast. So she concluded that the culprits had to be in the environmental influences. And she talked about the microbial world and the chemical world. And I'm going to add to this that we also need to look at another thing in our environment that's increased around this time, and that's electromagnetic frequencies. We need to think about all these environmental factors. So another line of evidence that we need to look at the environment in autism are genetic studies. Traditionally, we've thought that autism is due to genes primarily. That's what I was taught when I was in medical school. I was taught that the heritability or genetic component was about 90%. There was a large study done in 2011 here at Stanford, and they looked at twins. And so we use twins to understand genetics because twins, if they're identical, have all the same genes. And if they're fraternal, they have fewer shared genes, about a quarter shared genes. So they looked at identical twins, and they looked at fraternal twins. And they found that the rate of autism is about the same. So we can't say that's genes primarily, because the genes are different in fraternal twins and in identical twins. So again, they said some of this, a lot of this is in shared environment, in utero and in early life. And they said the majority of what was contributing to the development of autism, more than 50%, was largely environmental. And then there are also association studies. So these are studies where they simply look to see, is an environmental factor associated with higher rates of autism? And there have been a number of studies looking at this, looking at children who are born closer to freeways, they're more likely to have autism. Children in the Bay Area who live in areas that have more air pollution are more likely to have autism. And even indoor air pollution, when they looked at indoor air factors such as the flooring and condensation as a marker for maybe mold growth, they found that's associated with autism. So there are a number of things, and here I'm not saying that there's a study about EMFs and autism per se, but I think the larger principle is that autism is not due to one environmental contributors, and maybe not just due to the environment. It may be a complex illness, but there may be multiple environmental influences that are contributing.
And this is where it gets complicated, and it's also very hard to do conclusive studies. And it may be that none of these toxic exposures reach the threshold for toxicity, but we have to look at all of them. So now I'm going to switch a little bit to some clinical issues, and what do these children look like when I see them, and what do we know about their physiology, and what do we know on the cell level. And I'm going to have to race through this because I don't have much time. But one of the hallmarks that I see in these children, and I've just been observing them, is that a lot of children, both with autism and other developmental issues, their systems look like they're under stress. So more stress than you would expect. So how do these children manifest stress? And I'm not talking about older children who are going to Palo Alto schools and they have school stress. I'm talking about little kids coming in. And they often show things like they throw temper tantrums. They're really rigid. They can't move from one activity to the other. They can't fall asleep. They talk about being worried about things. And their parents say they're under stress. And over again, I hear that there's no obvious cause for stress in the home, in the school. They may have had a really good evaluation by a psychologist and they can't find a source of stress. And physiologically, we know that children with ADHD, autism, and some other developmental issues, their nervous systems show that they're under stress. So their nervous systems, the autonomic part of it, is more and almost a higher level of the flight or fight part. So they're in that fear mode rather than the relaxing, healing mode. And again, there are a number of studies that have shown this. And cortisol, you may know cortisol is one of the stress hormones that's released when we have stress. And we need that. We need that to be able to get through the day. And we know that children with ADHD, anxiety, and autism have dysregulated cortisol responses. They're not acting appropriate. Sometimes it's too high. In other cases, it's not enough. So they're showing that something is stressing their system. And then this is just a picture of cortisol. Their cortisol, as it varies with day, is very dysregulated. So often they can't get up in the morning, they're a little tired, and they can't fall asleep at night. And then what do we know on the cell level? So we just heard about the calcium channel and how that might be affected by EMFs. Another thing we found in children on the spectrum and ADHD is that their cells are responding as if they're in danger. So there's a researcher, Bob Navio, brilliant researcher, and he's come up with this model of the cell danger response, which he's found in lots of chronic illnesses. But the cells basically can't keep up with what's surrounding them. There's a mismatch between what's in the environment versus what the cell can cope with. And it goes into danger mode. And this is what they found in autism and ADHD. So again, what's causing the cells of these children to act as if they're in danger? And it may not be one thing, which is where it gets very complicated, where we can't say this is causing that. So again, what's causing this physiologic stress? And that's how I really think of it when I see these children. I came into psychiatry because I was interested in emotional development. But the children I'm seeing now in my practice, the primary issues often are not emotional. It's not a divorce. It's not stress in the school. There's a physiologic stress. There's a different way of looking at things. But we need to look at all the things that could be involved, including chemicals, metals, nutritional deficiencies, and EMF fields. So it's a complicated picture, and one of the terms for this is the exposome, which is the whole combination of all the environmental factors. And it also takes into account what's unique about the individual. So the children on the spectrum, there is a genetic component, and it's not the environment or genes, it's the interaction, or what we call epigenetics. So these children may be more vulnerable to the effects because of dysregulation with detoxification, because of neurotransmitters. We don't know all the mechanisms, but they may be the ones that are the most prone, and we're seeing the effects first, but all of us may be affected to some degree. So what's our challenge as people who care about children? Our challenge is how do we make wise choices to protect our children's health in the setting of an epidemic of autism, as well as other childhood developmental issues, insufficient scientific data, but emerging research, and I think strong research, regarding the impact of EMFs and other environmental toxins on neurodevelopment, and a very deeply flawed regulatory system. So I don't have to go into that because we heard a lot about that, and it's really important to know that we can't rely on industry guidelines. We have to be educated. So again, this is going to come up again and again. I advocate using the precautionary principle, and this is both clinically in how I educate my patients what to do at home, and then also as what we should be doing at a societal level. So again, the precautionary principle is that when something is reasonable in a setting of harm, we can take action. We don't have to wait for all the studies to be conclusive. So again, I'm not saying that EMFs cause autism. I think there are lots of factors, and we've talked about genes. There's also the gut microbiome, which I won't talk about today, but also I am concerned about environmental toxins. So one thing I ask my patients to do is to also reduce other toxins in the home. Because usually the patients who are sensitive to EMFs, these are the adults more who can talk about it, they're also sensitive to other things. And it's the total load. And I have a handout up front that I give my patients. So this is the cost of autism, just looking at a societal cost, and this is monetary, which obviously is not the most important cost of autism, but it's again an argument that we really can't stand by and not do something. I don't think that's an option. So the emerging literature suggests that electromagnetic fields may stimulate the synthesis of stress proteins and cause stress on the system, cause hypersensitivity. We've heard a great deal about the calcium ions. And again, the nervous system is very connected to calcium regulation. And when you have calcium dysregulation, that can lead to things like neuroinflammation, which is implicated again now more and more in psychiatric issues and developmental issues. And then lastly, again, children are not the same as adults. They're more prone to lots of environmental influences. And again, a child's skull is thinner, so when there are EMFs, they absorb more. And also to remember that if a child's affected, this is what's really heartbreaking, you put them on a different course for their whole life. So when I see adults, that can be heartbreaking, but they may come in with fatigue, dizziness, but you get them better, and they're better. With a child, we don't have that often. You affect development early on, and their path is different in life. And that's what's truly heartbreaking. And that's why I think we have to take action. So there are some early studies that cell phone use is associated with behavioral problems in children. This is the largest study done on 100,000 children in a Danish cohort study, and they found a correlation between the amount of cell phone use in utero and early in life. And this was replicated also in a smaller cohort group in a Danish study, and there was also a study out of Yale showing something similar. And we talked about this again, that children are different and they absorb more EMFs, and they're particularly vulnerable to these issues. So what can we do? Again, I think it's really important for us to take action at a societal level, but what can we do in our homes? Because that's also important. So there's some simple things you can do. Again, most of these things don't cost any money, and if they do cost money, they're not tremendous. So one is something as simple as turning off the router when you're not using it or at night. I'm always surprised by how my patients don't even know that's an option. They think they're going to lose data, it's complicated, but you just turn it off. And that way, at least when you're sleeping, you're not being affected. The other argument I get is, well, I live in Silicon Valley, it's not going to matter, there's a cell phone tower. But proximity does make a difference. And having it in your home versus a cell phone tower, usually there is a difference of magnitude. And I'll show how I teach my patients this. You can opt out of cell phones in most of the counties here, so that again, you can opt out of not a cell phone, sorry, that's a smart meter, that should be. You can opt out of having a smart meter on the house in most areas here, and that's one less exposure risk. Cordless phones, so a lot of people think cordless phones are not as bad as cell phones, and that's not true. They're also sending out, the base is constantly sending out signals. So what I recommend is, if you want one phone that doesn't send out a signal, have a landline, and then your cell phone. And I also recommend keeping phones on airplane mode when you don't need to use them, especially in the car, because that's a metal cage. Your child's in there, they're being exposed. So if you're not going to take a phone call when you're driving, and you shouldn't be texting and talking, then keep it on airplane mode. Keep it on airplane mode if you have a landline at home, and tell your family members and anyone else that that's how they should reach you when you're at home. It's better to text or use it on speakerphone, or you can get an air tube, which is it's a tube that doesn't have any electrical wire in it. So that way, at least if you are making a conversation and you want privacy, you can use the air tube. And that's what's illustrated here. And I also tell people, don't let your children play on a cell phone. A lot of parents, even in my office, give a cell phone to their child to play with as we're talking, because that's the only thing that they'll. So I tell them, just put it on airplane mode. They're not having a conversation. They don't need that feature. You can be on airplane mode and play a game if they need to do that sometimes. And unfortunately, the Environmental Working Group website list of cell phone recommendations is no longer available. because I think they just couldn't keep up with all the changes in cell phones. I also teach my patients to measure EMFs, and this can be expensive or inexpensive. So Gauss meter, this is looking at the low frequency EMFs, the things that are more hardwired, like the electrical wiring. And this can be an issue too. I have patients who are very sensitive because of low frequency EMFs. That's what they report, and they feel better when they're away from them. So again, we want to put them in a healing environment where we reduce possible stresses on the system, even if they're not conclusive. A Gauss meter you can get for about $60 to $180, a single axis meter. You just have to make sure that you measure all three axes, because it's only measuring one axis at a time. And that gives you an idea if your EMFs are very high. And I have some recommendations here, but they're, again, not conclusive. The high frequency meters, when we're looking at wireless technology, these meters are often much, much more expensive. At least about $700 are the ones I've seen, and sometimes more than that. So it's not pragmatic for most people to just buy one of these. You could share one in the community. I have one, and I like using it in order to educate people. So people don't realize that just having a phone by them in the same room can increase the EMFs by like orders of magnitude. And once they see that, they're more likely to do something like turn it off at night, put on airplane mode. Again, because we can't see these things, we just assume they're not affecting us, and that's human nature. This is a canopy, so it's a special cloth material that shields out all the high frequency EMFs. So for patients who are very sensitive, it's a way of like going back and living in the country, at night at least, and getting that respite. The downside is the cost, and this is why I don't know if I have a single patient who's actually doing this, because it's about $1,500. So it's an option, which I think many people would like to do, but it's not inexpensive. And then again, in terms of schools, so many of my patients now are educated and they take these measures at home, but then they go to the school and they're being exposed all day. And given the level of evidence, there are other countries who've taken action. And I didn't realize it was only in the preschools. I was hoping it was higher school levels. But there are other countries that have taken action. And I think the level of evidence that we need to look at environmental exposures and anything that plausibly could be causing stress in the system is strong. So I'm going to end on this and just say in conclusion that I think there is evidence that we need to take action, and that's both personally and then on a larger level.